Well, hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall, and I want to welcome you to this week's Value-Based Care Exhibit Hall Flash interview. And this week's guest is Carm Huntress, and Carm is the founder and CEO of Credo. Let me just mention that Credo is a company that specializes in automated patient medical record retrieval and analysis. And Carm will tell us a lot more about that in the next few minutes. Um, so that said, welcome, Carm.
Yeah, thanks so much for having me. Great to be here today, John.
Good, good. Yeah, great to have you. So I've just got a couple of questions for you today, and I think your answers will give us a much better understanding of Credo's capabilities. So, um, first question is, what does Credo offer value-based care organizations like ACOs and APMs that can help them succeed?
Yeah, I think the big thing we're trying to solve for value-based care providers today is getting complete medical records together and analyzed for every patient coming in for an appointment. So if you think about today's challenges for most VBC providers, they're still using antiquated methods like phone and faxes to get patient
Mhm.
medical record history. And that challenges the front desks or the care coordinators with a lot of extra time trying to get all those medical records together. Well, at Credo, we've connected to over 100,000 digital connections nationwide. We tap into these new national networks that were established as part of the 21st Century Cures Act. And we can go out for any patient and go and get all their medical record. And we even have a team that if we have to, we can manually get those records too. So we take all that effort off of the front desk and the care coordinators to have to go do that work. And then, John, once we get all that data back, we have both technology, machine learning, and AI that goes through those records. And for a sort of average MA Medicare Advantage member, we get about 1,000 pages of history on them, right, from years to decades back. We then analyze that with AI and machine learning, and then we have our own team of trained sort of clinical-based risk adjusters that go through and analyze the charts looking for what the current diagnoses of the patient are. So we make sure we know everything that's going on with the patient's diabetes or congestive heart failure. And then most importantly, we go through and look for suspect conditions. So are there things the doctor doesn't know about that they should to effectively treat this patient and take care of them? And then we're really focused on things related to risk adjustment. So we know the patient's well diagnosed, and those codes are submitted to CMS. And then really on quality, we're looking for things around, hey, has the patient had a colonoscopy? Have they had a mammogram? Have they had a DEXA scan? So those quality measures really are important to us too. And then we make sure the doctor gets all that data and information in a summarized report coming into that first appointment. So it's really impactful in terms of care and treatment and outcomes for these value-based care providers.
Well, that's very, very valuable. Let me just ask you one more question. Then, what sets Credo apart from maybe other companies that might be offering similar solutions?
Yeah, it's such a great question, John. I think the first thing I say is that we have a really big emphasis on retrieval.
Hmm.
There's a lot of companies that might look at the provider's own EHR and trying to analyze that data. We think that's important and we think there is value there, but it's really what's happening outside the four walls with a
Hmm.
patient that's so important for a provider to know what's going on with the specialist, right? The cardiologist or the endocrinologist. Have they had hospital visits recently? And can we get those charts back for the provider to review? That's essential data for appropriate care. And I think that's our biggest differentiator in the fact that we're getting all that data outside your four walls to help you best treat that patient. And a lot of other companies, I don't think, do that today or have built a network as large as ours connected to so many different health systems and providers to get all that data back. And then the second thing I'd really say, John, is that we care deeply about the provider experience.
Hmm.
And that's why we have humans in the loop checking over the data. The last thing we want to do is hand a report to a doctor that has a lot of false positives, that's making them have to do more work that's not helpful for the patient or for their day. We want that being, really accurate data that's been reviewed by humans, that's really informing that clinical visit and that encounter and giving that complete clinical picture. And I think that's really what differentiates Credo from a lot of the other solutions, whether those are vendors out there today or even homegrown solutions. And that's really our goal. I'll leave you with this, John, that we really want to get that complete longitudinal picture together of that patient. A lot of people are playing the risk adjustment game, and I don't think that's the answer. I think what providers really want is a complete in-depth understanding of the patient's disease and the progression of that disease over time. And that's really what we're trying to achieve at Credo.
Okay. Well, Carm, everything you've shared about Credo's capabilities, it's not only impressive, but it's also very timely. Big subject and issue right now in value-based care. So thank you for that. Folks, for more information, please feel free to visit the Credo booth in the value-based care exhibit hall. There's lots of useful resource information there. So I'll conclude by just saying thanks, everyone, for joining us. And a special thanks to you, Carm, for being with us right now.
Yeah, thanks,
Goodbye,
John.
everyone.